All right, Mr. Wolf, it's good to see you again.
Good to see you.
This is the second time that I've seen you and Lila, and I know that the reason that we've been coming here is because you had some concerns with whether or not she was vocalizing enough, and so we went ahead and looked at that last time with some informal observations and some questionnaires that we had you fill out. And so we do think that Lila may be slightly behind in vocalizing due to her premature birth, which I know you said was at 35 weeks, right?
Yes.
Okay, so she was born at 35 weeks, so she was a little over a month early, which can cause some delays, we know. But we're not seeing anything serious with Lila, just the concerns that you had with maybe she's not vocalizing enough. So I know you'd also said she has had ear infections. Is that correct?
Yeah, she's had a couple. She had one at 4 months and then one at 7 months.
Okay.
Yeah.
So she's had 2 ear infections, which if she would continue to get quite a few ear infections, we could be concerned with that and affecting her hearing.
Okay.
But I know last time we kind of had you go to the other room and call her name.
Yeah.
And she did turn her head to your voice, so we're not concerned with her hearing at this point.
Okay.
Because she did turn to that sound and that familiar voice, which was good to see.
Great.
But back to her ability to communicate, I know something that we really want to focus on with you and that you can share with your wife when she's home is that infants communicate in different ways. It's not just through vocalizing, it's through reaching and through their eye contact and for grabbing that a toy that they're interested in. So I would just like to see if Lila will do that with you and if you can recognize those communication acts that she has with you.
Okay.
And if you can see right now, she's not interested in what you're showing her. She'd rather look at me.
Yeah.
So that's a communication that she's showing us that with her eye contact that she's not interested in the toys and now she's looking at you. So those are those communication acts that we'd like to help you guys recognize and see and to know that yes, she is communicating, which is great to see. It's just not verbally right now a lot with her voice. And another concern that I kind of have is how much she has her pacifier in.
Yeah.
Is that something she's really connected to, or?
She has it in quite often.
Okay.
But she's not. I mean, I guess she is sort of attached to it.
She's attached to it. Okay. Well, I wonder what would happen if we did take out her pacifier to see how she would react.
She wants to grab it.
Hide it from her. The reason I asked to see what would happen was maybe without that pacifier in her mouth, she might be more willing to use her tongue and to vocalize.
Okay.
That kind of blocks that sound in there. We can maybe see her mouth move a little bit more.
Okay.
So that's something, you know, if she doesn't need her pacifier at the time, you know, go ahead and take it out.
Okay.
And that will give her more opportunities to communicate vocally.
All right.
Instead of just sucking on that pacifier all the time. So, and there we go. We heard it.
Yeah.
Heard it.
So she wanted to get that toy.
Yeah, so good job. I like how you noticed her intent that time was reaching down. That was her communication saying, I want this toy. So that's exactly what we want to be seeing from her and continue those interactions like that.
Okay.
I also remember from last time when your wife was here, she'd said that she thought maybe some community activities with Lila would be good for her and to socialize and see other babies too.
Yeah.
So I went ahead and found, you're going to talk to us. Yeah, good. So I went ahead and found at the local libraries that are close to your house. You're not happy? Does she make that sound when she's not happy, or?
Well, it's
seems
sort of, yeah, I guess it's sort of newer, but probably within the last week or two.
Okay.
But
yeah, that sounds like
pacifier,
Okay.
but
Yeah.
just because
And
it's
that's
more
fine.
of a cry.
Yeah, no, and that's fine. And you always want to take care of her needs. But if she would have her pacifier in her mouth all day long, that's when, that could be something keeping her from vocalizing.
Okay.
So we want to make sure that she gets that practice in and that chance to do it. But that was really good communication on her part, and good for you to observe that and respond to her communication. That shows her that when I use my voice, I get a response.
Okay.
So she's learning that she can use that to get things she needs. But these programs at the library that I found are just a baby and me story time, and they've got a couple of those, and most of them are during the day about 10:30. But they do educational themes, and they really emphasize the interactions between the baby and caregivers, and do finger plays and songs, and so those could be excellent things for Lila to be involved in, and just nice activities for you and your wife to do with her. And then they also have this one that's for Dad and me, story time. So just the two of you wanted to go. That's one just for dads. And then if we have some continued concerns with Lila, if we don't think that she's progressing enough in her small you see Daddy? There's also this program called It Takes Two to Talk, and I'll leave this with you. And what it is, it just helps parents understand their children and how to become better communicators with their kids. It's a very, very parent-friendly program. It teaches parents to follow their child's lead, which means to follow their interest.
Okay.
So right now, Lila's interest is the paper.
Yeah.
So following her interest in what she wants to do, and then teaching parents to keep those interactions going with what their child's interest is. And also then adding language to those interactions. So this is showing the bath time down here, and the parent is saying wash, 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 wash your hands.
Yeah.
So just kind of that labeling thing and telling our child what they're doing.
Okay.
So when she's getting closer to a year old and 18 months, and we're expecting more words from her, it'll help expand that vocabulary.
Yeah. Yeah.
So we always want to be developing those language areas in her brain, especially since she is about 5 weeks early, which isn't a huge amount of time, but just enough maybe to see a little bit of a delay in her language.
Okay.
Are there any other concerns that you have at this time?
No, I don't.
Okay.
Thank you.
All right, we'll see you in about a month then.
Okay.
All right,
See ya.
thank you.